All right, good evening, everyone. This is Dr. Rodney Gonzalez, your Amarillo VA Healthcare System Director. I want to thank you for joining our virtual Women Veterans Town Hall this evening. Here with me today for our discussion panel, we have our Women's Health Program Coordinator, Kristen Fife, and members from our executive leadership team. As you have noticed, tonight we are using a new platform for the first time for our virtual town hall. So this one works a little bit different than we've done in the past, as it is using your mobile device, your tablet, or your computer connected to the internet. So if you want to ask a question, you will look somewhere on your screen, and it depends on what you're using as to where it is. There's going to be a Q&A button. If you click that button, it gives you the opportunity to type a question, which will then go to our team to look at and then let us know what questions we have that we can answer. I do want to remind people, please do not share personal information when submitting a question, because after our screener reviews it and they publish it for us to try and get to an answer, the exact question will be there. So any personal information would be there. They will not publish a question as personal health information. Now, if you're having technical issues, please disconnect from the meeting and re-click the link you had to rejoin the meeting. This is our first time using it. The person who was going over it with us said that usually the best way to fix most of the problems is to disconnect and reconnect. Now, we hope this platform works out well. We know other VAs are using it for their veteran town halls, and there is a weekly meeting the VA has with staff, and they use this platform for it. However, we would appreciate any feedback you have. So you can put your feedback in the question and answer section, because we'll be able to take a look at that later to see if this platform works well. If you like it, you don't. And so we'll get started with some announcements. But thank you for joining us. So first thing, I want to talk a little bit about beneficiary travel. Beneficiary travel is a reimbursement process, or excuse me, the beneficiary travel, if you use it, the processing times currently may be extended beyond the 30 business days that we try to meet due to a temporary shortage of beneficiary travel personnel. We apologize for this inconvenience and appreciate your patience as we work to bring on additional beneficiary travel staff on board. Now, selections we are going through, and we've made some selections, and now we're working to get them onboarded. But it does take a little bit of time to work through the process to bring a new member on board. We have approved current staff to work additional hours to help minimize the impact on veterans. And I do encourage veterans to consider filing through the Beneficiary Travel Self-Service System, or BTSSS, to experience faster claim processing than those who do the paper claims, which does require some additional steps in order to process the entire claim. So I would encourage veterans to move to the online system. And the other thing that's beneficial about the online system is you can track the progress of your claim. Next, I'm going to talk about War of the Wagons. So our suicide prevention team is teaming up with the Texas Panhandle War Memorial again this year, and they will be doing their third annual War of the Wagons event on Saturday, August 28th from 6 to 9 p.m. This event will be located at the Texas Panhandle War Memorial, which is at 4111 South Georgia Street in Amarillo, Texas, 79110. This is right where Georgia Street and I-27 intersect. This event is a free family event that is going to feature live music, food trucks, vendors, and more. The purpose is to bring our community together ahead of Suicide Prevention and Awareness Month, which is in September. And provide resources to support veterans and their families. Somebody caught, we have Saturday, it is actually Friday, August 28th. Emily, do I have that right? Yes, it is Friday, August 28th. Sorry, my notes say Saturday, and I'm reading my notes and not thinking about what the actual day is. Thank you, Dr. Bazaz, for catching that and making me aware. Now you know I can see the chat thing that you're talking on. All right. The next announcement, go ahead to our next slide, is coming up is International Overdose Awareness Day. International Overdose Awareness Day is August 31st. In the Thomas E. Creek VA Medical Center, the Lubbock VA Clinic, and the Clovis VA Clinic are going to have tables set up in their lobbies from 8:30 a.m. to 4 p.m. to bring awareness to drug overdose and prevention, as well as provide Narcan training. International Overdose Awareness Day is a global campaign that brings people together to take action on overdose. International Overdose Awareness Day is observed on August 31st each year, with events that take place throughout the world in more than 40 countries. And so if you would like to come in one of our clinics, Amarillo, Lubbock, or Clovis, in our lobbies, we will have some tables and some information. Next. All right. This year, we will be having our second annual Candlelight Vigil on Saturday, September 12th at the Lubbock VA Clinic in honor of Suicide Prevention and Awareness Month. This is a free event from 6 to 8 p.m. with free food, a ceremony, vendors, and a car show. Now, hopefully this year is not interrupted by rain like it was last year, although I think the rain was earlier in the day and a Texas Tech football game. But looking forward to that event and encourage people who want to come and take part in that candlelight vigil. Now, that is all of our announcements today. And so I would like to hand it over to our Women's Health Program Coordinator, Kristen Five. Kristen?
Thank you, Dr. Gonzalez. I do have a few women's health announcements before we get into our topic for this evening. If the mammography center has already scheduled a mammogram appointment for you, please be sure to contact the women's health team prior to your appointment date. This is to ensure that a VA authorization for this imaging has been sent to the facility. This is to prevent you from receiving a bill later. So please let us know if you have an appointment scheduled that we did not schedule for you. Regional Summit. We had last month, our Women's Health Program attended the VA Center for Women Veterans Regional Summit in San Antonio. This was the first of 5 regional summits. Each summit provides an opportunity to meet other veterans, representatives of the VA to discuss areas of concern, as well as meeting with VA claims representatives face-to-face. Each day consisted of a main session hearing from VA leaders, Office of Women's Health Leadership, community care, and many more. Small breakout session topics covered everything from how to apply for a federal job through USA Jobs, pain management, overall health, and the I Am Not Invisible campaign portraits. Although our regional summit has passed, there are still opportunities for you to attend others around the country. And on this slide there, you can see the different regions. If you'd like to find out when the summits will be held, you can visit the Center for Women Veterans website. Women's Equality Day. I want to mention that Women's Equality Day is observed every year on August 26th to commemorate when the 19th Amendment was ratified in 1920, allowing women to vote. To celebrate, Women's Health will have resource tables in the Medical Center and Lubbock VA Clinic lobbies on August 26th from 9 to 11 a.m. Now for our Women's Health topic this evening. I will be discussing VA maternity care coordination. Did you know VA provides maternity coverage and care coordination to help create a seamless maternity care experience? Maternity care is covered by VA. Each VA facility offers ongoing maternity care coordination via the VA Maternity Care Coordinators, or MCC, who collaborate with you to guide you through your care. VA covers a wide range of maternity care services throughout pregnancy, delivery, and postpartum. Maternity care services available through the VA include full physical exams and lab tests, prenatal education and screening, obstetrical ultrasounds, genetic tests and specialty consults, prescription drugs, labor and delivery, newborn care on the date of birth plus 7 days immediately after birth, lactation support, support and services in case of miscarriage or stillbirth, social work and mental health services, and the maternity care coordinator, or MCC. VA also covers nursing bras, breast or chest pumps, and maternity belts. Request these items through your MCC at least 2 weeks before your due date. You can get other supplies such as lactation pads, human milk storage bags, and nipple cream through the VA pharmacy. VA benefits may not cover all services, including home deliveries, doulas, or experimental procedures. Your MCC can answer questions on coverage and connect you to additional resources. Every VA offers maternity care coordination. VA maternity care coordinators can answer questions you have about services and coverage through every stage of your pregnancy. Maternity care coordinators can help you navigate healthcare services both inside and outside of VA, access care for your other physical and mental health needs, connect to community resources, cope with pregnancy loss, connect to care after delivery, and answer questions about billing. How do I access services for maternity care coordination at VA? You'll need to be enrolled in VA healthcare. Ask your VA primary care provider to get you connected with our women's health program, or give me a call at 806-472-3400, extension 3539. For more information about our women's health program, visit our website at www.womenshealth.va.gov for more detailed information about what VA has to offer women veterans. If you have questions or can't find what you're looking for, you can also call, text, or chat online with the Women Veterans Call Center at 855-829-6636.
All right. Well, thank you, Kristen, for sharing all that information. I asked our team when we were talking about things if we could talk a little bit about the maternity care that is offered through the VA. I know often we look at the care and we sometimes forget that we do offer maternity care, and I want to make sure that our veterans are aware of that. And whether it applies to you or not, you can make sure our other women veterans are aware of the maternity care provided through the VA. I do really appreciate you, Kristen, for being here tonight and discussing these topics with our women veterans. Now, one thing I want to say is I do want to encourage all of you to stay informed with VA. We have multiple platforms, digital platforms for which you can keep informed. First, we do have a presence on Facebook. You will see how to sort of search us on these platforms. Now, some of these platforms I don't know as well, such as Instagram. And I think that's a more popular one with some kids, like my kids. But we are also on Instagram. We are on X, or formerly called Twitter. And we do have a YouTube account where we post videos. And one thing that I will say real quick is, as we know, when we did our previous town halls, we're doing them on Facebook Live, and that is not something we're able to do. One of the things that we are looking at is what would be the possibility of taking this recorded video and possibly hanging it on our YouTube so people who want to view it later. We don't know if that's possible right now, but it's things that we're looking into. We also want to encourage you to subscribe to our Veteran Monthly newsletter by visiting our website. And also, we do have these monthly veteran town halls that we do every month of the year, other than December. Now, we do have 2 that we do face-to-face in Amarillo, and 2 of those months are face-to-face in Lubbock. And so there are sometimes that we may not have the virtual platform. And then obviously we have a couple months, such as this month, that we focus on our women veterans. So usually there's 2 months that we focus on women veteran topics. So those are some places that we share information. Encourage you to try and find more than one platform, because I know sometimes some we are able to get information out a little bit quicker than others. So if you rely on just our newsletter, for example, you may only be getting updates monthly, and we might have other things we're able to put out sooner. All right, now with that, we are going to get to questions, but I don't see any questions right now. I did see that we did have somebody drop a comment in about they like that we're using this platform. I see we have about 12 online right now. So if anyone has any questions, please type them in. Once again, hit that Q&A button, and then you can type in your question. We just have some people that are reviewing those questions, and we'll get them out to us. As a reminder, do not share personal information, as we cannot display that for all veterans, and anything you put in that question, once we publish it for us to look at, it'll be seen by all veterans, and so any personal information would be viewable, and that would cause us to not bring the question forward. If you do have personal questions, please let us know, and we can have one of our team members get back in touch with you in the next day or two, or one of our screeners can respond through the messaging back to you. But we would be happy to also look at your personal questions. So some of the things you might want to let us know are what things do you want to know more about in the VA, or if there's any specific questions you have about a VA program or service, or if there are other topics that you would like us to speak at our next Women's Veteran Town Hall or General Veteran Town Hall, please suggest some topics, and we will look at those for consideration. All right, I'm trying to see. Oh, we might have got a question. Okay, so there is a question about postpartum care. Kristen, do you want to come online and talk about the postpartum care?
Sure. So the VA covers postpartum care up to when your OBGYN, I don't want to say discharges you, but typically when you no longer need to see your OB, then the VA covers all of that up until that point, and then we're happy to take over your care back over when you've been discharged from the OB.
All right, thank you, Kristen. I also see somebody asked about why we are using this platform. And so I'm gonna say there's a few reasons why. Number one, when we do our big veteran town hall, the platform we're using, we are limited to how many veterans we can call. And so not every veteran is able to even be attempted to be able to connect with it. We have a limit that we are able to call out. This platform has virtually, and I'll say virtually, no limit, which means we can have as many veterans join as possible. The other thing that we can do on this platform that we cannot do on other ones, as you see, we can share slides that we can display additional information. Obviously, if I were to sit here to read a bunch of phone numbers to you, number one, I will probably mix up some digits, and that will make it very difficult if you're trying to use those digits later to actually call whatever we're passing on. But it allows you to see it, and since you're on your mobile device, tablet, or computer, you can probably get a screenshot, take the time to write it down. And then the other thing is, sometimes we have issues with the phone, because if you don't get the call, we can't get you back in. That system has some limits. In this, if you were to suddenly get disconnected right now, if you click back into that link, it will bring you right back in. Now, we know there are some limitations in any platform. Just like I mentioned some limitations with the phone, we know there's also some limitations here. Number one is, since we depend on some sort of a digital connection, most people do have connection to the internet through cellular, Wi-Fi, home internet, or whatever. But we've have some people who have trouble getting in other ways, and so it allows some things. But we also know that there are some areas, especially in some of the more remote areas in the Texas Panhandle, where internet connection may be less reliable. And so those are some of the reasons. And then, like I said, there are many VAs using this platform, and so we were encouraged to give it a try. And so you never know until you try. And so here we are trying to use it. So hopefully that helps the person who asked that question. And it looks like we have another one. Says, I actually found this difficult to get into. Have you covered anything about elder? I'm 76 care for vets. So Kristen, I know, do you want to talk a little bit about care for some of our senior vets, and specifically towards the women veteran? this person's just going to ask me to get in trouble if I call them a senior vet. So hopefully they're not offended by that. But I'm trying to figure out how to say it. I'll use elder care for vets. So that's what she used.
I like mature.
Mature. Okay. Thank you, Kristen.
You're welcome. We covered the full lifespan of care for women, from maternity to perimenopause, menopause, bone health, really anything that you need healthcare wise. I encourage you to speak with your primary care provider, and they will get you taken care of. And if there's anything that you want more information about, please let us know, and we can definitely get that to you. We also have focus groups once a quarter. So if there's a specific topic that you really want to know more about, then we are happy to have that topic in a focus group and invite you to attend.
Yeah, and for the person who put that question, you can obviously type another question answer if you wanted more. But for anyone on there, if you in the question answer, type and say, hey, I would like to have somebody call me, give us your name, number. We won't publish it where everyone can see it, but we will have it so we can get back in touch with you down the road. Does anyone see any other questions? Okay, so we've got some other topics we were going to cover. And so let me go to Kevin. I think I gave you this one. Kevin, did I give you the one on emergency care notification?
Yes, sir.
Oh, good. I called the right person. So I'm going to bring you online. And Kevin, chat with us about what veterans can do if they need emergency care outside of normal clinic hours.
100%. So that's a great question. So a lot of times our veterans have that perception that they don't need to check in with the VA first before they go seek care in an emergency room or one of those freestanding urgent cares. And that, unfortunately, is not the way things are. We really must follow certain rules within the VA. And the main reason for that is that we can cover those costs of care. Because for us in the VA, we want to make sure that you get the care, whether we provide it or if it's out in the community. But if you find yourself out in the community and you're receiving care at one of those emergency departments or freestanding urgent cares, we have certain rules and policies that we have to be notified within 72 hours of that emergency care. And it's mainly so we can process all of the consults and the behind the scenes items to make sure that that care is paid for appropriately. So one of the big requests that we ask of all of our veterans is to save this number into your phone. So if you ever find yourself in a emergency room or an urgent care or end up being admitted to a community hospital, that you can let us know. So that number is 844-724-7842. And once again, that's 844-724-7842. So please give us a call. And mainly this does apply to the emergency departments, but some of those urgent cares that we call the nomenclature of urgent care and ER. So when in doubt, just give us a call and we'll make sure that we get you taken care of.
Yeah,
So,
thanks, Kevin. I appreciate it. Hey, a couple things I just want to say. First of all, if you look on the slide that's showing, that phone number is on this slide where it says 24-hour non-VA ER cares. So if you didn't get it when he said it, it's right there. But I also encourage you not just to put it in your phone, but any family member, loved one you have that or a caretaker, have them have it in their phone. Because if for some reason you can't make the call or they can't get into your phone to get it, if they have it, they can call the VA and let them know that you are getting care. All right, I think we had a couple other questions come up, and Kristen, this probably next one is best for you. I know you talked a little bit about it later. What is the status of the mammogram?
I was just going to comment on that. I'm not clear on what specifically you're talking about. Can you clarify? Is there a specific concern or?
We'll have to wait and see if they type something
Yes.
in the comment. So we do not offer mammograms at the VA facilities. In order to have a certified mammogram program, you have to be doing, I could have this number right, so someone else correct me if I'm wrong. I want to say it's 2,500 mammograms a year. And you have to be doing that many. Well, in the entire Amarillo VA healthcare system, we only have about 2,200, is it, Kristen, right about there, women
Right.
veterans. So even if every woman veteran qualified for a mammogram every year, and they all lived in the same area, we wouldn't even get to that number of what we need to do. And we have to remember, we have two major populations area, Amarillo and Lubbock, and then we have others throughout the Panhandle and Eastern New Mexico and South Plains. So any one of those areas are not going to have enough to get it. And so we have to use our community partners for mammograms. Kristen, anything else you want to expand on that, or did I hit it all?
You hit it all.
Okay, so, but we can, if you need a mammogram for screening, if you meet that qualification, we can arrange to get it out in the community. Depending on where you live will depend on, how close it is or where that is for you. I mean, obviously, if you're in Amarillo or Lubbock, it's not too hard to get it in those communities. In some of the smaller towns, you'd probably have to travel to where the mammogram would be. Did I get that right, Kristen?
Yes, sir.
Okay. All right, let's see. Looks like we have another question in here. Are there resources for veterans where vets can get educated on electrician, HVAC, plumbing, and the like? All right, so this is a little tougher question because it falls outside of the VHA, Veterans Healthcare Administration. Jason, I'm going to reach out to you and tag you here to see if there's anything you want to talk about. I know there are several veteran groups out there, veteran service organizations that they can go to, but I know we do have some offices here that might be able to talk to people or point them in the right direction, not VHA offices, but some other partners who work with us. Jason, are you able to allude to some of that?
Yes, sir. I dropped a link in the chat in response to that question. We do have the Veterans Readiness and Employment Program, VR&E, and we do have personnel stationed in Lubbock that are part of that program. The first step is to go to the VRE website and apply for benefits. A benefits counselor will then reach out to you, do a conference, get some more information, find out what your goals are and stuff. And then they will develop a plan, see what you're eligible for, and get you going from there.
Yeah, thank you, Jason. So, hey, Jason, just so you know, is they can't see the things in our chat, so I put it as a response to their question in the comment.
Oh, that's
then they can see
where
it.
I put it.
Oh, it didn't appear there. It showed up in our chat, so I don't know. Okay,
That's weird.
maybe my screen didn't refresh, and maybe it's now in there twice. So, oh, yep, I just didn't refresh my screen. It was there. Never mind. Slow army, Jason.
I wasn't gonna say anything.
You Navy people are much faster than me, see? All right. Doubly helpful. Thanks, Patrick. All right, let's see. Do we have any other questions? And let me refresh to make sure. I don't see any others right now. So one of the things I wanted to also talk about, Mike, are you available to talk about suicide prevention, or are you tied up right now?
Yes, I'm available. Can you hear me, Dr. Gonzalez?
Yes, we can hear you. Go ahead.
Okay. Yeah, so 988 is a 3-digit number. That is a veteran crisis line number. It is actually a national crisis line, but we do have responders specifically trained to respond to our veterans. So we do follow up with those calls locally if you let them know you are a veteran. And anyone can text or call that 988 anytime, day or night.
Thank you, Mike. I appreciate it. You know, one of the things I always like to talk about when I talk about the Veterans Crisis Line or the 988 number is to remember this number can be used by anyone. You don't have to be a veteran. The 988 is usable for anyone. When you press 1, it connects you to the Veteran Crisis Line. But if you know somebody who's not a veteran, they can still dial the 988 and it will get them to help. If they're a veteran, active duty service member, guard, reserve, then if they hit 988 and then press 1, it will connect them to the veteran crisis line. All right, I
Yes,
think we
sir.
have, okay, looks like we have a question in here, and Dr. Bazaz, I'm going to ask you to be ready. I think you see it because I saw you just typed something, and I did see your comment. So I'm going to talk about it. We probably need to remove this off because it does have specific information. So go ahead, Dr. Bazaz, if you can talk to the person's question.
Yes. Well, welcome and thank you for joining us. It was talking about Alzheimer diagnosis or the high risk for being Alzheimer. Some advanced blood tests may show that, and was asking about resources. I would I definitely is establishing with a neurologist as a first step is the most important one, because once again, the blood tests can tell a story or part of the story. The full story comes from meeting the patient, examining the patient, looking at their family history, at their own history, advising them, and tailor a plan just specifically for that person. So I would definitely use that as a first step. Second is if we can get back and we have a contact information and ask specifically on what kind of resources or services or advantages this specific veteran is asking for, and then we can also tailor that towards their need. But I would agree with start with a neurologist.
All right, thank you, Dr. Bazaz. So we have another question here, Dr. Bazaz. I'll have you stay on. You and I can probably both answer it together. Can clients get more than 6 massage and chiropractor appointments? So Dr. Bazaz, I'll let you go first, and then I'll cover if there's anything else I feel we need to say.
So clinically, there is no identified limit or the best number of sessions to have to achieve a goal. It all is again tailored to the specific needs of the veteran. When it comes to the authorization of how many, that becomes a little bit more administrative, and I cannot tell you on top of my head how many are the specific authorization go for.
Okay, thanks, Dr. Bazaz. Yeah, so a lot of times, sometimes we get limited based on what we can do on the referral, and we have to see some benefit of the therapy. Just like if I was on a blood pressure med, but my blood pressure is staying high, they're going to change my med. They're going to stop that med, put me on something else, do something different. Well, if somebody's getting chiropractor, massage therapy, other therapy, and they're not getting better, then at some point they're going to say we need to stop and try something different. Now, if we're seeing that benefit and we're seeing a measurable improvement, then there are ways to get it continued. It does have to be reevaluated, looked at, and then potentially a new consult or a new request for services. And so, you know, I don't know where the number 6 came from, but sometimes there are limits if based on the diagnosis and what they're asking for, where they may only allow so many consults and then it would need to be renewed or refreshed. Dr. Bazaz, did I get all that right, or anything I may have misrepresented?
No, sir, that is accurate.
And one of the things we can do is on a future town hall, we'll get Stacy Bird back on. She's in charge of our community care. And so sometimes these are things that apply when we go to community care for consults. And so that would help us in getting some of that information. See if we have any others. Don't see any others. Dr. Bazaz, I think I gave you it since I had you online. I think I gave you a topic to talk a little bit about the surveys that veterans may get in the mail after an appointment.
Correct. And let me use this to appeal to our veterans and women veterans to take the opportunity to participate in those surveys. This is how they can tell us what we're doing good and what we need to improve on. I'm specifically talking about SHEP survey, and the SHEP survey, it's basically asking you the veteran, how well did we do during your visit? There are multiple questions that you can answer and rate us from 0 to 10. And then those results come back aggregated, and we see what we're doing good to continue and what are the areas that we can improve on. SHEP stands for the Survey of Healthcare Experience of Patients, and it is either mailed or emailed to the veteran after their appointment. The time may vary into when they are mailed or emailed. So please, if you get that, tell us what we're doing great and tell us what you wish to see us doing better. This is the only way we get better, and this is the only way we can capture everyone's needs and tailor our services to what matters most to the veterans.
Great. Thanks, Dr. Bazaz. Appreciate that. Hey, Jason, looks like we got a question, and you are probably the best person to answer it. How can I get my last name changed in the VA system? Jason?
Yes, great question. Thank you. What you're going to need to do is come to the Enrollment and Eligibility Office, either in Lubbock or Amarillo, and even in Clovis. One of the representatives can help you there. Bring your current form of valid identification, like a driver's license or a passport, secondary document like a social security card, and that has to have your new updated name on it. And we will process that, and it takes a week or two for it to get identified and uploaded and changed by the Master Person Index through ID management. But we do that in person. You have to bring those documents so we can scan them and upload them into the system. Thank you.
Hey, Jason, I'm going to ask, because I know they do a lot of things virtually now. Does VA.gov, if you log into your veteran portal, do you know if they have ways of submitting those documents? I don't know the answer to that, so figured I'd ask you.
I know you can upload documents to augment and support a disability claim, but as far as the name change, as far as the name change goes, no, I don't believe that's something they can do. They have to do that in person.
Okay. See, I don't see any other questions. I think, Jason, stay online. You ran away. We've got the beneficiary travel and other transportation services. Can you just let our veterans know, give them a reminder? I know I talked a little bit about the current delays we're having with beneficiary travel claims due to a shortage of staff, and we're working to fill those gaps right now. Can you go ahead and talk a little bit more about some of the transportation services we have?
Sure. The VA's transportation program, VTP, offers many different solutions to and from their VA healthcare facilities for appointments. The program oversees the services at little or no cost to eligible veterans through our beneficiary travel program. That reimburses veterans who are eligible for costs incurred while traveling to and from VA healthcare facilities. The BT program may also provide pre-approved transportation solutions and arrange special mode transportation at the request of the VA. Special mode would be like your wheelchair vans, your ambulance transfers, stuff like that, or even flights. Veteran may be eligible for common carrier transportation such as bus, taxi, airlines, or train under certain conditions. VTS, we have the Veterans Transportation Service, uses VA associated vehicles and third-party transportation to help veterans get to their appointments. That would be more like your ambu vans, the Panhandle Transit, those kinds of agencies, and then our own vans that we can use to transport ambulatory and wheelchair-bound patients. Uber Health Connect is another program that we have. If our system gets a little too overloaded, we might lean on Uber Health. And again, you have to be eligible for beneficiary travel to qualify to use those services. To request a ride with VTS, please call our phone number 806-468-1515, 1515. And you can use our beneficiary travel self-service system, which Dr. Gonzalez talked about previously, also known as BTSSS or BTS3. And this is our online interface for claims where you can, and caregivers and veterans can submit and track their claims. It provides a more veteran-focused experience for beneficiary travel reimbursements, allowing claimants to submit and track their claims at their own convenience. It also provides capabilities for beneficiaries to receive payments by electronic funds transfer and helps eliminate fraud, waste, and abuse. Let's see what else here. Payments are faster, and the use of direct deposit ensures faster access to monies are paid out. Again, we're experiencing some delay in processing those claims due to personnel turnover. I think we had said earlier about 30 days or more to process those claims. And the BTSSS is much faster than filing a paper claim. So highly recommend getting online and getting that BTSSS.
The other thing is with that, Jason, they can also track the progress of it and see where it's at and see, if they're getting closer to that reimbursement.
Yes, sir.
Hey, I see we had another question drop in, and I'll take this one. Is there anything we can do to push forward legislation on getting the VA to cover dental for all service-connected veterans? Okay, so this is a very good question. The first thing I will say is in all of our official capacity working at the VA, there is nothing I can do. I am actually by Hatch Act and other things, I cannot do certain things or push it. Now, as a personal, private citizen, there are things that we can do. You as a veteran, I would encourage you to talk to some veteran service organizations that or veterans groups and encourage them to talk to their legislative branch about it. But ultimately, as I've said before, it is a congressional statute or congressional law that says who we can and cannot treat with certain areas of care, and dental being one that only if you have 100% service-connected disability can we do dental care, or if you have a service-connected dental condition, and then we can take care of that service-connected dental condition, but are not able to do beyond that. That is, once again, it's by statute or law, and it would take a Congress changing the rules on that. And so, people can advocate to their congressional members or through veterans groups, through their legislative branches to try and get that changed. Daryl, I know you're our AD, and a lot of times I'll see if TJ has anything else. Do you have any other comment on that, Daryl?
No, sir, I think you covered it quite well.
All right, looks like we had another question that just dropped in. How can I change getting my prescriptions in person rather than it being mailed? John, good thing we had you on. Go ahead, I'll let you come on screen and answer that for us. John is our chief of pharmacy.
Thank you, sir. So very good question. We do get asked that quite frequently. And we are mandated to use the CMOP facility, which is the Consolidated Mail-Out Pharmacy, which is a mail-out service for all pharmacy prescriptions throughout the entire VA. We have to use it, and so you can pick up your prescriptions if it's a new prescription that is you're seeing the clinic and the provider is wanting you to start a new medication and they write for it. We can get you started on it immediately, and you can come to the pharmacy in Amarillo or Lubbock and come pick it up. However, all refills are done through CMOP and we have to use it. I'm sorry, we can't do refills here. I don't have the staff to do the number of refills that we process every month. It is actually a very good service through CMOP. And I tell this often in terms of getting your refills, and Dr. Gonzalez knows this. If you are on a medication and you take it regularly and you're going to be taking it for a long time, what I ask in order to get your refill timely is as soon as you get the medication, turn around and request your refill. And you can do that either by calling it in, or you can send in the refill slip that is accompanied with each prescription that has a barcode on it. You can mail it to us or you can drop it off. Or what the method I really prefer is to use My Healthy Vet and get connected to there and request your refill. As soon as you request it, our system will keep track of it and it will mail to you timely and you should not run out. And for the majority of our veterans, it works very well and they don't run out of their medications.
Yeah, thanks, John. And I will tell you, as a veteran who has some medications I take chronically, the My Healthy Vet renewal in the process where he said, and I don't necessarily do it when I get mailed the new one, but I do it when I open the new container. I basically get on My Healthy Vet right then and order my next refill. I won't get it for a couple months because the system knows when I should be getting short and being mailed it. But I have never had an issue where I had a gap of my medication. So really encourage, but you don't have to use the My Healthy Vet. You can do the phone number on it. You can drop that paper off at the pharmacy, but it will still come through the mail order pharmacy. All right, let's see. Do we have any other questions? All right. So, hey, a couple things that I want to say. First of all, if you have a question, please try and get it to us. I'm looking to see if I have any that are being reviewed right now, but I think we got to them all. Would encourage you to give us some feedback on this platform. I know it's different. I know we did not connect to as many veterans as we typically do because I can see how many joined. But there is, every platform has its pros and cons. And so please give us some feedback on how this worked out for you. And then I do see we just had one drop in. Are there any resources to help veterans with updating or creating wills and trusts? I don't know if we have somebody that's in the best field to answer that. I will tell you it is going to be limited. There are some services where there are some legal aid clinics. However, you have to meet certain criteria to qualify, and not every veteran will qualify for that. Jason, or actually Mika, do any of you have any details on that, or does anyone have any details? I know we have one that comes here to Amarillo, but there's certain criteria to meet it. Okay.
I do, yes, sir.
Oh, go ahead, Jason.
Yeah, so there is legal clinics that we do offer, but like Dr. Gonzalez said, we have to have certain requirements to meet those. We do offer some certain documentation like living wills or advanced directives. But as far as wills and trusts goes, that's more specific to the legal team, a personal lawyer, or something like that. So,
Yeah, and I will say is right now I'm not aware of any. Now, I think Emily said that Lubbock also has those clinics, but she does post them on Facebook when we know they're going to happen. But there are some requirements to meet, and not every veteran is going to meet the requirements to get that, because those are some local attorneys that are pro bono giving their time, and there are some limits we have. Okay. Let's see. Somebody just posted something here. I'm trying to read it. It's a long, thanks, Belinda. It's way too much for me to read. It's I don't know who's this from. I don't know who this is. So I know. But understand is There are some ones, we'll see if there's some things that we can share on our Facebook on some resources, but it is limited as to what is offered. All right, so let's see. I do want to thank you all for joining us tonight. If we didn't get to a question or you had something more personal, please leave us a message. You can also email amarillo.va@va.gov, and we'll have somebody follow up with you in the next couple days. I do want to thank you for joining us tonight and providing us with your feedback. It's been a pleasure to serve you, and I always look forward to all of our veteran town halls. Remember, our next one will be a virtual town hall. Don't know if we're going to use this platform or go to the old one. We are going to talk about this as a team and try and get some of the feedback we got from all of you. And then the next one will be on September 17th. And the topic we will discuss is Suicide Prevention and Awareness Month. Now, however, we will take questions on any topics. Belinda just told me the Legal Aid of Northwest Texas is who's posted that. So there's a thing on some legal advice for veterans. Thank you, Belinda. I do want to thank you for our service to our country. Hey, I just want to give a shout out to some of the people that work in the background here. You see some of our faces come on, and so we're the ones often doing the talking, but we've got some great staff in the background. And so we have Air Force veteran Emily Bell, Navy veteran Patrick Hutchison, Orlando is in there. Mika's in the background. Belinda's a Marine veteran. Orlando, Mika, if you're veterans, I apologize. I just didn't know what service or what. But we have, just a great team that makes this happen so we can get out to our veterans. And then they work these extra hours when they could be with their family. So thank you for doing this. Appreciate all. I do want to thank all of our veterans for their service to our country. And thank you for giving us the opportunity to serve you with your healthcare needs. Have a great evening.